Hi, everyone.
Hi.
My name is Dr. Amira May Woodruff.
And I'm Dr. Warren Woodruff.
And we're both dentists and owner dentists here at Smiles Family Dentistry in West Bloomfield, Michigan. And today we're going to be going over some of the pressing dental questions that a lot of patients ask us, a lot of friends ask us, kind of going over that. And we also have some really great prizes, so stay tuned so you can win.
And don't forget to follow us on Facebook and follow us on Instagram at Caring Smiles FD. We always like to post a lot of fun pictures and dental informational tips, and just like to we have a lot of giveaways. So it's just our way to really educate the public on dentistry, and we have a lot of fun on there. So make sure to follow us on Facebook and Instagram. Again, one more time, we're at Caring Smiles FD.
Hi, Chris. I see you joined.
All right. So we're going to kind of go over what we're doing today. We do have a lot of prizes that we're giving away. The first one is Amazon Fire Tablet 7. This is actually going to one lucky patient whose name will be drawn later on this evening, who's referred us a patient between the July 18th and September 28th, which is today. So we have a raffle drawing for that. We appreciate all the referrals that our patients have given us. This is a fun tablet. It will work out great, and it also works with Alexa. So yeah, be ready for that.
So the next prize is an Oral-B Genius electric toothbrush. It has Bluetooth. This is for someone who entered our raffle at Family Fun Night. West Bloomfield had a Family Fun Night at West Bloomfield High School, and that was September 15th. And we had a raffle. It's right here. All these people entered.
A lot of people.
So we're going to be picking someone, and they'll win that.
Okay, and lastly, we have some trivia questions today. I know everybody likes Starbucks. We have Starbucks gift cards we're going to be giving away. So we're going to be asking questions that can be anything from things that we posted on our Instagram and Facebook to just dental questions in general, or to anything. So anyone can win. So just be on the lookout and be ready to answer. I see there's a comment box on the side. So answer the question. You're ready to answer the questions, and you can win a gift card to Starbucks.
And also, while we're going over everything, if you think of any questions that you have, feel free to put it there. We'll try to keep track as we go as well. So the first question we get a lot, we've gotten this a lot from lots of patients, is why can't I just have a regular cleaning if I have periodontal disease? The reason for that is because when you have a regular cleaning, it's someone who basically has a healthy mouth already, healthy gums. Even if you have cavities, your gums are healthy. When you brush, when you floss, you're not having a lot of bleeding. So when you do a regular cleaning, what you're getting off is any plaque that's above the gum line. It's getting off any tartar buildup. And what tartar is basically plaque that's been sitting there for a long time and it's gotten hard. So even if you see it or you feel that it's rough with your tongue, you actually can't take it off with your toothbrush at home. So I don't know if you've ever had the experience of you got a cleaning and then afterwards it just feels really smooth in the front. You keep licking, you keep feeling like it feels different, it feels smooth. That's because all the tartar is gone. So if you have periodontal disease, you're someone that doesn't have very healthy gums, or you have bone loss, you have gums that might bleed a lot. And what that means is that you have pockets around your teeth. And I can show you a picture here that gives you an example of the pockets. I don't know if you can see that. So right here, right in there, those are pockets. And if you were to do a regular cleaning, you wouldn't be able to reach down all the way to get everything out. So you'd be leaving all that tartar buildup, all the plaque, all the bacteria down in those pockets, and it would just make the situation worse because that's the area that needs to be cleaned the best. And so with a deep cleaning, that's actually what's needed. It's called the deep cleaning, also known as the scaling and root planing. And what that does is it gets everything out of the pockets to give you a chance to get better and to stop the disease process. And it's different in the sense that it takes longer. If you need a deep cleaning in all areas of your mouth, we usually split it up onto the left and right side, and each side is an hour-and-a-half appointment, so it's about 3 hours, as opposed to a regular cleaning that typically you're done in about an hour. There's different techniques, sometimes different tools. So if you have periodontal disease, you cannot have a regular cleaning because that's not what's appropriate for you. And let's see, the next thing we're going to do, see if there are any questions. The next thing is a trivia question. This is the first one for the Starbucks gift card.
Starbucks gift card, $10 Starbucks gift card. I know people like their morning coffee.
Okay, so this question is, on August 14th, Dr. Warren spoke to a group of patients at Royal Oak Beaumont Hospital regarding the correlation between oral health and what disease?
So you can answer in the comment box to the right, and we'll see who gets the answer for this $10 Starbucks gift card.
And there's a little hint that if you don't know, our Instagram page does have a post about it, and our Facebook page.
And you want to repeat it one more time?
Yeah, so the question is for heart.
No.
Lex said heart. No. So what did Dr. Warren present to Royal Oak Beaumont Hospital? Diabetes.
Yes, we have a winner, Carissa Kennedy.
Yes.
Diabetes. Yes, I gave a speech about the correlation between oral health and diabetes. There's a lot of oral manifestations that show up in the mouth that we can see that sometimes is related to diabetes. So if somebody is diabetic, well, we know that they're more prone to have symptoms and signs such as bone loss or periodontal disease and different things like that, and vice versa. If somebody comes to us and, they haven't been to their physician a long time, and we're starting to notice other health concerns or issues, and we also see that they have a lot of bone loss or periodontal disease, we will be recommending them to see their physician, because it could be that they have diabetes that could be also playing a role in that disease progressing. So we always take a look at the whole entire body and the whole entire everybody's entire health when we're doing our exams, and we like to educate our patients and let them know that it's not just the mouth that we're looking at, but we're trying to make sure that your whole entire body is healthy, because a lot of times you see your dentist more frequently than you see your physician. So.
Definitely. So we have our second pressing dental question. This will be Dr. Warren.
Okay, so I get this question a lot. I come in, the patient has just gotten their teeth cleaned, and then the first thing they ask, or they're informed that they have a cavity, and the first thing they ask is, my tooth's not hurting, nothing's bothering me. Do I need to get this taken care of right now? Are you sure I have a cavity? Can I wait till my next cleaning appointment in 6 months to get it filled? Do I just have to, because nothing's bothering me? And so I like to always let people know there's a reason why your tooth is not bothering you when we find a cavity in the early stages. So I have a little chart here that I want to try to show. I think it shows it better. So basically, yeah, you can hold it. So basically what this chart shows, kind of starting from our early cavity all the way to a big cavity. So when someone gets a cavity initially, it's in the white part of the tooth, which is called your enamel. There's no, your nerve is not connected to the enamel, so there's no sensation for any time you may be chewing something. There's no pain or anything associated with. So when we see these cavities still in the early stages that are in the white part, there's a cavity that still needs to be taken care of, because once you get to a certain stage, it cannot be reversed. No matter how well you brush and floss and get your teeth clean, it has to be removed and a filling has to be put in place. As that progresses more into the inner layers of your tooth, which is called your dentin, then the next inner layer is called the pulp chamber, or where the nerve is. That's when you start feeling pain. So when a cavity gets bigger and it's gotten its way into the dentin, which is the next layer, these have these little tubules that make its way all the way into the pulp and to the nerve, which gives out a flag or a kind of an irritation signal anytime something cold, or if you're chewing sweets or anything hits this tooth, that's when a person's in pain. But the issue is that when it's gotten to this stage, it's already a big cavity, and sometimes it can progress very quickly. Okay, we're back. Okay, we're back. Looks like we got a little disconnected. Sorry about that. But anyways, like I was saying, is once you get to the nerve and you have that pain, or as the cavity grows to the nerve, that's when this patient needs a root canal. So the important concept of this whole thing is that the sooner we take care of a cavity, the less likely you are to have a problem, and the less likely you are to have anything than just a simple filling placed, or and you're not going to have any pain. So there's not going to be any pain during the whole procedure. A lot of times, even when the cavity is just in the early stages, we don't even have to use anesthesia. to do the filling. So,
and also the less expensive the treatment is. So prevention is good for lots of different reasons.
All right.
So the next thing is our first raffle. This is the raffle we mentioned for the electric toothbrush. We'll show that again for people who just joined.
Exciting electric toothbrush, Oral-B, Genius. It has Bluetooth technology on it. I use it at home. It's a great toothbrush. So we're going to be giving this away, and we have a raffle. These were actually for, just a reminder, this raffle was for the people we met at the West Bloomfield Family Fun Night about 2 weeks ago. They had a great event at the West Bloomfield High School, involved the entire community. We had the police department, fire department, and just a lot of the community leaders, people in the school district. So we got to meet a lot of people, and we had a great time. A lot of kids showed up, and then there was a big West Bloomfield High School football game after that. I'm a graduate of West Bloomfield High School, and so I'm a big fan of all the sports teams, still try to catch them when I can, and we had a great time. So when people came up to our table there, we had a raffle that people filled out, and so we're going to be pulling the name of that raffle prize winner, and we'll go from there. So.
We got a lot of entries, so good luck to everybody. Thanks. Okay, we have Tracy Gully.
Congratulations.
Congratulations, Tracy.
Congratulations, Tracy.
So we will be contacting, couldn't show it because she has her personal information on there, but we'll be contacting her and letting her know that she won and she can come get her electric toothbrush.
All right.
Okay, so the next pressing dental question that we get probably more, this is probably the number one, is are dental x-rays safe? And basically what we want to know is this too much radiation, more than I should be receiving? So we got this question so much that maybe about 5 or 6 years ago, I did some research into exactly how much radiation you are actually getting. And we did a post on our website. It's called X-ray Radiation Dose, The Truth. It's on our blog. So if you do want all the details, you want to refer back to it, you can just go there. So I'm going to be referring to it because I don't know all the numbers here offhand. But the average dose of radiation that each person receives is about 620 millirems per year. So at 620 millirems per year is what the average person is exposed to. If you're somebody who works with radiation, you're actually allowed up to 5,000 millirems per year. So to give you an idea of how that breaks down, common sources of radiation that every single person receives is first cosmic radiation. That's from outer space. So just walking around outside, the radiation you're getting from outer space in Michigan is 28 millirems per year. If you lived in a place that has higher elevation, you would be receiving more per year. The next one is terrestrial. That's from the ground, and it's 30 millirems per year. After that, food and water, 40 millirems per year. And from the air, 228 millirems per year. So at least every single person is at least receiving 326 millirems of radiation per year. So then, if you want to compare that to dental x-rays, if you're coming, you've already had your full set of x-rays, you're coming just for the 4 that we take to check for cavities in between your teeth, that's a total of 2 millirems. If you're getting the one that goes all the way around your head, it's called the Panorex, that's 4 millirems. And just to kind of compare to other things that you're doing every day, when you're flying in an airplane, every half hour is 0.5 millirems. When you're watching TV, it's 1 millirem per year. If you live in a stone, adobe, brick, or concrete building, it's 7 millirems per year. If you smoke half a pack of cigarettes a day, it's 18 millirems per year. If you get a mammogram, it's 42 millirems. If you get a hip x-ray, it's 70. So you can see how it goes up and up. If you get a CT scan of your heart, it's 2,000 millirems. So all that to say that if you don't do any of the other things that are on this list, which everybody does, like flying and living and watching television, then your dental x-rays out of the year would only be equal to less than 1% of your total radiation for the whole year. So yes, they're very safe. And these numbers were actually based on the older kind of dental x-rays. In our office at Smiles Family Dentistry, we have digital x-rays. So not only are they quicker, we can see more, we can, like Dr. Warren was saying, we can catch things earlier on the x-rays, and your x-ray radiation dose is even smaller. So nothing to worry about. The benefits greatly outweigh any type of risk there would be with radiation. Hope that answers.
So we have our next trivia question. Everybody get their fingers ready on their keyboards. And we're giving away another Starbucks $10 gift card. I know people love their coffee. So the question is, what is the name of the movie that Dr. May and I were extras in? And there's a hint. We did place a picture of us on our Facebook and Instagram a couple months ago with George Clooney on the set of this movie. So if you don't know, you can quickly check Facebook or Instagram and see if you can find it on there. But like I said, again, the question is, what is the name of the movie that Dr. May and I were extras in? And there's a picture of us with George Clooney on the set of the movie.
And you can only win if you haven't already won the Starbucks gift card.
Yeah, so
if you've
already won.
Yeah, so that's Carissa. So if you won a gift card the last time we did a live video, then you can win again.
But you can only win once on today's event. So
this is a tough question. We might actually have to, we'll give it a minute, but then we might have to come back because everyone's probably going to have to check Instagram or Facebook.
Remember, again, this is our Instagram and Facebook name at Caring Smiles FD. So make sure you follow us and like us on Facebook and Instagram. We have lots of contests and fun content on there as well. So, and this sign actually was made from one of our friends, Chris Kyle. He has a company called #Props. I went to high school with him. So check out #Props if you want to get your own custom sign made. It's really cool. So.
Okay, so Carissa answered, but she can't win. So if someone wants to copy her answer, then then you'll win. Oh, goodness. So I know there's also a delay. There's a delay, too. So sometimes we're getting your messages a little bit after you sent them. So we can move on, and we'll keep an eye out to see who wins this one.
Okay. All right. So the next...
Okay.
Right.
So Tatiana Love won. Ides of March. Yep.
Okay. So the next question is, let's see. Okay, so the next pressing dental question is, why does the dentist check my blood pressure? Now, you may notice, I'm not sure if your dentist does, but we do at our office is we check blood pressure anytime you come in for any sort of, routine cleaning, if you come in for some dental treatment. Majority of procedures, we are checking blood pressure ahead of time. And so a lot of people ask, why are you checking my blood pressure? I'm just coming to get my teeth cleaned, or I just want to get my mouth worked on. What does this have to do with my blood pressure? What does that have to do with the rest of my health? I find so many times that people try to separate dental from the rest of their health, and you got to understand that your mouth is the first area or the first portal of where anything you put in your mouth starts in your mouth, and then it works its way to the rest of the body. So your mouth is very important, and the connection between that and the rest of your health is very important too. So back to the question on why we check the blood pressure. Just one thing is 1/3 of people with high blood pressure in America don't know that they have high blood pressure, and half of those people have been possibly prescribed, or the people that do know and they've been prescribed medications are not even taking the medications properly. So people that have high blood pressure are more at risk for having a heart attack or a stroke. They like to call this a silent disease because most people do not feel any pain or discomfort until it's too late with high blood pressure. Most people visit their dentist more frequently than their physician. We recommend at least twice a year that we're seeing a dentist. I know a lot of people only see their physician when they have a problem, so they could go several years without even having their blood pressure checked. But what's important in the dental field is because epinephrine, which is the natural produced hormone that makes your heart rate and blood pressure go up, causes your blood vessels to constrict or tighten. So epinephrine is something that's commonly used in local anesthesia. So if where you have to numb you up for a procedure, they can make that numbing effect last longer, and it can also, cause your blood vessels to constrict more. So if you have high blood pressure and they're already constricted, that can also lead to a stroke or a heart attack in the dental chair. So anytime we see someone have really high numbers, and we're gonna really sit down with you, we'll take it again, but there will be some times where we will say, you have to go see your physician or Okay, sorry, it looked like we disconnected for a minute, but we're back now. So, yeah, so like I was saying with epinephrine, it's just something that's in a lot of the dental materials and things that we use and anesthesia that we use. So that's just one of the things that can cause, someone that has high blood pressure at risk for a heart attack or stroke. So, our number one goal when you come to our office is not just to treat your teeth and take care of your mouth, but to make sure your whole body is healthy. So we really, really put our patients' health and safety first. And that's one of the reasons why, and most important reasons why we're checking your blood pressure. You may be able to find someone that doesn't check your blood pressure, but we highly recommend it. The American Dental Association recommends it, and it's also what we were trained in school. We both went to the University of Michigan School of Dentistry, number one school in the world, number one dental school in the world, actually. So, yeah, that's just really important to us. So.
Okay, so the next and last Starbucks gift card trivia question, this is a tough one, is, well, as many of you know, we post on our Facebook and our Instagram page about our dog, Quincy. He's a golden doodle, a miniature golden doodle. And this trivia question is about dogs. How many teeth, how many adult permanent teeth do dogs have?
Okay, so you can put the answer to the right and we'll see who wins. $10 Starbucks gift card for the winner.
We'll let you know. If somebody's guessing and you're way too far off,
you can only win once, so if someone's already won a prize, you can't win again.
Yeah, so Carissa and Tatiana cannot win again this time.
Mm-hmm. See, we have some other people join.
Yes,
hi,
thank
Eve.
you.
Hi, Travis.
Thank you for joining. We appreciate it.
Yeah, Eve actually went to dental school with her husband, and her husband just opened a dental practice. So congratulations.
Congratulations.
All right.
So we do get a delay, so we're not sure if anyone's responded yet.
All right.
Oh my gosh.
We got
okay.
A winner.
That was so right. Either you are amazing, you're a vet, or you Googled really quickly.
But congratulations to Amin Bouzain. So yeah,
congratulations.
We'll try to reach out to you and get you this $10 Starbucks gift card.
Congratulations, Amin.
Okay, so
so the next question, and this is actually our last question that we already had planned, but we have time for more questions, is how old does my child need to be before they see the dentist for the first time? And we do get this question a lot. I guess a while ago, pediatricians were more recommending like age 2 to 3. But more recently, if you have a young child, you probably have heard them say that they want the child to see the dentist by age 1. And that's because we want to see them after 6 months after their first tooth has come in. And most children will get their first tooth around 6 months. So around year 1 is when we like, exactly, somebody answered. Right. Around year 1 is when we like to see a child. And the reason for that is we don't expect the child to let us do a full cleaning. We don't expect, for it to be super easy. We just expect it to be somewhat fun. We want them to come. We want their first visit to be a great experience. We come, we show them our instruments, the tools, the air, the water. They get to go to the prize box if they're a good listener, just so they can see that it's not scary. And we also use that time to check to see if the appropriate teeth are coming in. We also look to see if there's anything we can notice genetically wrong with any teeth that are in. We use the time to speak with parents about taking care of the teeth, about going over eating and drinking habits at home, and basically just kind of getting everybody on the same page. And then we bring them back every 6 months. It's basically just checking and making sure everything is going as planned. So age 1 is the answer to that question. And actually my niece just came yesterday for her first appointment. She turned 1 last weekend. So she did a great job, and we were glad that her first experience was something fun. She wasn't coming in because something bad was happening or she had a big cavity, she was hurting, and she even let us clean some of her teeth. So which that does not always happen at age 1, but it's great to bring them in that early if you can.
Okay, and I forgot to put the picture from earlier, the earlier trivia question we have, but this was Dr. May and I, we were both in extras in the movie The Ides of March. And
That's
so
right
you
there.
can see us there, and you can see us talking to George Clooney, which is right here in the middle. This picture was actually captured by, they had some paparazzi kind of hiding in the background. This was located in Bloomfield Hills, where they were filming this at a church. And so, yeah, I forgot to, I think it was back in 2011 when we were there. So, yeah, we had a great time. Unfortunately, our scene that we filmed here didn't make the final cut, but it was still cool meeting George Clooney.
Yeah. This was way more exciting than filming the movie.
Yeah.
Because we were joking with each other, and then he overheard us joking, and he was commenting on it, and that's when they took the picture. So that's why he was looking at us. Okay. So
next one, we have another raffle prize. We're giving away an Amazon Fire 7 tablet, and this is actually for one lucky patient that we've had. We appreciate all our patients that refer other patients to us. We appreciate people leaving reviews on Facebook, on Google. I mean, any of that helps, because people, when you have a good experience, I'm the same way. If I have a good experience at a business, I like to let other people know, and so that helps people grow their business. So we appreciate it.
Really appreciate it.
Anybody who's referred us a patient between when we did our last Facebook Live, which was July 18th, until today, we kept a tally of all those names, and we are going to be pulling a name from that, and they're going to be going home with the Amazon Fire 7 tablet. And this has Alexa on it too, so anybody using Alexa or the Echo and all that, this works with it.
And the way it works is all you have to do is tell someone about the office, tell them to come, and as long as they actually come and they have an appointment with us and they tell us your name, you don't have to do anything else. Once they tell us your name automatically is entered. If you brought 10 people in and they all had appointments, you have 10 entries into the raffle. And after today, we'll be doing, it's probably about to say, we'll be doing
more prizes.
More prizes. So keep referring people. One tip that a lot of people have been doing is posting about us on Facebook. So if you do a post, all your friends on Facebook see about the office, or if you have a friend who's looking for a dentist, they ask for recommendations, just sharing it. And then a lot of times people have been coming to see us, and they put their friend down from Facebook as the referral, and the friend doesn't even know that they have entries in here because they didn't even tell their friend that they were coming. So that's the quickest way to get lots of names in here. And some people did that, so they have a higher chance. So you want to pull?
So I think you're, oh yeah.
Yeah,
all right, so the winner is...
You can show the name.
Okay. Michelle Hudson. Congratulations to Michelle Hudson. You are
Congratulations,
winning,
Michelle.
You are winning the Amazon Fire 7 tablet. So congratulations. Thank you for the referrals.
Thank you so much.
Appreciate it. Like I said, we're going to have some more contests in the future. So stay tuned. We'll post it on our Facebook, Instagram, what the next contest will be, and let people know. So thanks for that. And next, I wanted to kind of use this time, got a couple more minutes left, just to open this up to any dental questions you may have. Anything that you may be afraid to ask the dentist, or just you always wonder, and this is your time, you can just post it in the comment section, and we'll see if we can try to answer that for you. We have a couple more questions too that we can answer, or that we can talk about if we don't get anything, but let's see if anybody has any dental questions.
Well, while we're waiting for questions,
yeah, we can start on one. Okay, so another question we get a lot from people is, you know, I used to have insurance, or I never have insurance. My current employer doesn't offer dental insurance. So what do I do? I want to see the dentist, but I don't have dental insurance. And the first thing I always tell people is that dental insurance is a lot different than medical insurance. Medical insurance normally covers the cost 100% of majority of procedures, and then you may have a very small copay. This could be something as little as, you know, some routine checkups at your physician, and it could be something more serious, maybe as a surgery. So people think that dental insurance is the same way, but dental insurance is a little bit different. It's more of like an assistance for somebody that has really healthy oral health, that takes care of their teeth, goes to the dentist every 6 months. If they need just a simple cleaning, or maybe a simple filling, or maybe, you know, one simple crown, usually their insurance plan covers the majority of that procedure, and then the patient only has to pay a small copay. But if there's a situation where there is, you know, multiple teeth that may need treatment, or it's a more comprehensive treatment plan, that insurance is not going to cover it enough, or a lot of it. So we do actually offer our own plan here. It's called the Caring Smiles Dental Savings Plan for patients that don't have insurance, and it actually saves you a lot of money. The cost to enroll for one adult is $299 for the year, and what that covers is 2 regular cleanings if you need regular cleaning, any necessary x-rays, exams throughout the year, and then you get 20% off of any dental work that we recommend, and you get 5% off any over-the-counter products. We sell some products here as well. Okay. Sorry about the disconnect again. I'm not sure why that's happening, but like I was saying about the Caring Smiles Dental Savings Plan, works great. If you have any family members, the second family member is cheaper for that. It's $50 cheaper for the second family member. It's even cheaper for kids as well in your plan. So works well. Like I said, normal. It's probably twice as much for you to pay out of pocket than to sign up for the plan. So just something to think about. Let friends know. If you don't have dental insurance, doesn't mean that we can't see you or dental is too expensive. The savings plan is very inexpensive. It's actually cheaper than if you didn't have insurance and try to sign up for some dental insurance plan that you had to pay a monthly premium for. The most thing that's most important though is that there's no waiting period, and we don't have to send predeterminations to insurance companies. So you get that treatment done that day when you're ready to move forward. You don't have to wait when you enroll for 6 months or anything like that. And yeah, it works great for the whole family. So yeah, just definitely, if you have any questions about that, you can give our office a call. Our number is 248-973-8788, and we can definitely give you more information about that.
So we do have one question from Carissa. She says, under what circumstances would you need to take a child to a pediatric dentist rather than a general dentist? So at our office, we do see the entire family. We see lots and lots of children, all ages. And we tend to only refer to pediatric dentists when we feel that it's safer for that patient and for us working. And an example of that would be if they're just very apprehensive, they won't sit still, they're moving too much, then that can lead to something that's a not safe environment for treatment. Pediatric dentists have extra years of training and working with children. A lot of them do sedation dentistry, where they can help the child to relax so that they're more comfortable and less fearful of the dentist. And that's pretty much, we don't have to refer that often, but we are very quick to refer when we know that it's going to be best for the child and for the parents and for us too.
All right. So we have another topic that we can talk about while we're waiting to see if anyone else. If you have any questions, put in the comments. We got a couple more minutes. We'll be on here. So any dental questions you want to know, or just in general questions that have always been in the back of your mind that you always want to ask the dentist, maybe you're afraid to ask, or your dentist didn't have time when you were going in to ask. So yeah, you can ask in the comments. But you can go ahead and
okay, yeah. So one thing we could talk about while we're waiting, if there's any more questions, is some people like to ask, a lot of people, I should say, most people, is how can I get my teeth to be whiter? And in terms of whitening products, we've seen lots over the years, lots of different kinds. We've seen the over-the-counter kinds, we've seen the home remedies, but what we have found to work the best is our in-office treatment, and it's called core whitening. And this is their brochure.
But we're going to actually show you a picture of before and after one of our patients in a second. So.
Yeah, so with core whitening, it's one of the best on the market in terms of not having as much sensitivity. A lot of people experience sensitivity with whitening their teeth. It also has the best results in terms of going up from different shades of white. And I am always someone who is quite unsure when I get pictures like this in the mail, because I wonder how much it was altered, what's real, what's not real. And that's why we're going to show you an example we had. This patient had what's called tetracycline staining, and basically what that is a medication that they took when they were or actually a lot of times what happens is when their mother takes the medication while pregnant, it can cause this in the teeth. And so we don't see it as much in younger adults because now that we know that happens to teeth, people are stay away from it when they're pregnant. But this patient had it, you can see right here, and that was the shade of their teeth before we did the whitening, the core whitening, and then this was after. And these are our actual pictures, our actual patient.
Yeah, they haven't been altered or anything.
Yeah, and we were shocked with the results just as much as the patient. We knew that core whitening was a really good product and it was the best that we've seen, but we were not expecting him to get his teeth this white after the treatment. So the way it works is that you have trays that we make in the office. So let's say you come in and you say, you know what, I want to get started on whitening. Let's get started today. We would take impressions of your teeth. We would make trays, and then we would give you those trays with gel to take home. You would use that gel for a couple of weeks, and then you would come back in. What that gel does, it kind of gets your teeth ready to accept the in-office whitening more. So then at that appointment in the office, that's when we do the treatment that it's about 3 cycles. It takes 20 minutes each cycle. And then you leave with your teeth as white as they're going to be. And then you have the trays that you use before the treatment to use after too. So we'll give you some gel that you can use as maintenance. You can do touch-ups as you need. We give you all the information tailored to each person because everyone's different. Of course, this person had a little bit more they had to do.
We did two sessions of whitening on that patient due to the tetracycline staining. But it's a great product. Patients love it. I know a big concern with whitening is sensitivity. There's a lot of things that we do with this product to help decrease sensitivity. So yeah, to me, it's the best product on the market. There's products at home that people try. I've seen the Crest whitening strips. I've seen the Zoom whitening. All those are nice products, but it's just the results are not consistent. So that's what I look for is consistent results that work. So
with the products over the counter too, they're not made exactly for your teeth. So they don't quite fit all the crevices. So let's say you get really white on the front, but down the sides where it wasn't actually touching everywhere, it might not get it quite the same. Also, what's really important is making sure you're doing whitening on a healthy mouth, no cavities, no gum disease. All of those things can lead to a lot of sensitivity, a lot of discomfort, and more problems. So you want to make sure that your mouth is healthy, you don't have any cavities before you start trying to do any whitening. And that's what we always make sure when you're getting whitening done in our office.
Any other questions or anybody? We got time for maybe 1 or 2 more questions that we'll do. If you do have one, just put in the comments and we'll answer it. But okay, another question I'll do while we're waiting to see. Get a question, you know, this is the fall, school is back in session. We always push and we say it's important no matter how old you are, that if you're playing any sort of contact sport, you should be wearing a mouth guard. We make them at our office, and what I like better with the ones you get in office versus at the store is that they're going to be custom made to really fit your teeth properly and really protect your teeth from injuries. I don't know how many of you are sports fans, but there was a basketball player named Isaiah Thomas last June who was playing in the NBA playoffs. He's on the Boston Celtics at the time, and they're playing against Cleveland. Wasn't wearing a mouth guard. He was going down the court, and he got hit in the face, and his tooth came completely out. And so that can be prevented with a mouth guard, but we want to let you know if you come to a problem where tooth gets knocked out with you or your child, what to do. So first thing is that if it's in a baby tooth, there's nothing to do. You keep that tooth out. Obviously, you're still going to call your dentist and have the dentist take a look and make sure everything else is okay, but don't try to put a baby tooth back in the mouth. But if it's an adult tooth, and remember, adult teeth start coming in as early as age 6. Usually that front adult tooth, which is the most common tooth to get knocked out, comes in between 6 and 7. But if that tooth gets knocked out, you have about a 1-hour window. If that tooth completely comes out, that we can replant that tooth back in, and then it's about a 50% chance that that tooth can be saved with some additional treatment. And
that's if the whole tooth comes out, yes, which is about this long. You only see that much, but there's a big root in there. If your tooth actually gets broken off, then that's a different story.
Yeah, we still want to see if your tooth gets broken off and try to fix it, but we can't take that piece that broke off and put that back on. There's other ways that we can help restore your smile. But if the whole tooth comes out and the root comes out, what we what we recommend doing is that do not clean off the root that you see of the tooth. Do not wipe it off. If it is dirty, just gently rinse it with some cold water, or like some saline, which is contact lens solution, or milk for about 10 seconds. But do not scrub it, because your tooth is actually a living organism. So at the time, there's things on the root that if you rinse them off, there's no way that we're going to be able to put that tooth back in and to be able to save that tooth. So if possible, and that tooth comes out, you're going to want to try to reinsert that tooth back into the socket yourself. It may sound kind of scary or crazy to hear that, but if you can get that back in the socket itself while you're on your way to the dentist, you have a better chance of us saving that tooth. Now, if that can't happen, there are a couple of things that you can put that tooth in. Some places will have this, such as, let's say you're in a sporting event, an athletic trainer may have this, but it's called Hank's Balanced Salt Solution. Comes in a lot of different packages. Here's one, but that's one thing that you can put some of that like in a jar and in a Ziploc bag and put the tooth in that. But most people don't have that. So what's the next best thing you can use is cold milk. If you have cold milk, you can use that. Or you can use saline, which is contact lens solution, to put that in a Ziploc bag. But a lot of times you don't have anything, or you're nervous, you're panicking, it came out. So just your own saliva, the person whose tooth has come out, if you can put your own saliva like in a Ziploc bag and then put the tooth in that saliva and then call your dentist right away and try to, get to your dentist. Okay, sorry we got disconnected again. I don't know what's happening, but yeah, just as I finished, put the tooth in a Ziploc bag with your saliva in that Ziploc bag, and try to see your dentist. You have about an hour window for us to see you, and then there is treatment that we would do at the office to try to save that tooth. So yeah, that's just kind of how that is. Let's see if there's any other questions. We appreciate everybody joining in. We'd like to say, congrats again to all the winners. And like I said, follow us on Facebook and Instagram at Caring Smiles FD. We have a lot more contests. We definitely want to do another Facebook Live again. So yeah, stay tuned for that. We appreciate all our patience.
And for people who are joining that didn't see before, just as a quick little recap, the winner of the electric toothbrush was Tracy Gully. And then the winner of the tablet,
that's the Fire tablet, was
Michelle Hudson. And then we had 3 winners of the Starbucks gift cards. It was Carissa, Tatiana, and Amin. So congratulations, everyone. Thank you, everyone, for watching. We really appreciate it. We're going to keep trying to do these every now and then. Send us your questions. Even if we're not doing a video, you can send us a question. We'll try to put it in our next video. Please tell anyone looking for a dentist about us. We're accepting new patients all the time, and we'd love to see them. Yeah, we're located in West Bloomfield. We're in the Beaumont Medical Center at West Bloomfield on Orchard Lake Road in between Maple and 14 Mile. So can't miss us. We're in the big Beaumont building, and we're happy to see people. Again, our phone number is 248-973-8788. And we do have some evening hours as well, so we can see you after work and after school. So yeah, don't forget to follow us on Instagram and Facebook. Thank you, everyone. Thank you. Have a great night. Yep.